Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Wonka. Here are some of the highlights this hour. Minister of Aviation clarifies unconfirmed reports on the resumption dates for international flights, says no fixed date yet. NITCOM chairman says over 6,000 Nigerians stranded abroad have been evacuated by the federal government since the outbreak of the coronavirus pandemic. And concerns over coronavirus leads to cancellation of the Nobel Prize banquet for the first time in more than 60 years. According to the Nigeria Center for Disease Control (NCDC), Nigeria has now tested 218,223 coronavirus samples nationwide. 562 new cases were confirmed by the NCDC, recorded in 20 states, which saw the FCT recording 102 cases, the highest, overtaking Lagos and other states in its daily caseload at 102, putting the total confirmed cases at 37,225. On the same date, more patients recovered and were discharged in 12 states. 228 of them in states like Edo saw 60 recoveries, 36 in Ogun State, Plateau 31, 26 in Abia, 19 in the FCT, 15 in Ebonyi, 15 in Kaduna, Benue 9, 7 in Rivers, 5 were discharged in Gombe State, 3 in Borno, and 2 in Bayelsa State. However, the country has lost over 800 people to the virus. The deaths have been recorded in the 36 states and the Federal Capital Territory, with 12 deaths in the last 24 hours recorded in 8 states, to include Anambra, Delta, Ebonyi, Niger, Bayelsa, Gombe, Ondo, and Rivers State. Now, over 6,000 Nigerians who were stranded abroad since the outbreak of the coronavirus pandemic have been evacuated by the federal government. The chairman of Nigerians in Diaspora Commission, NITCOM, Mrs. Abike Dabiri Erewa, says some of the evacuees include Nigerian students abroad, those who migrated for other businesses but became stranded due to the lockdown measures imposed by several countries. She advised Nigerians abroad to be good ambassadors of the country, and also says the federal government will no longer tolerate the maltreatment of its citizens abroad.
The Nigerian Diaspora Commission, the Ministry of Foreign Affairs, and our missions all over the world have been in the forefront of evacuating stranded Nigerians abroad. As of today, we have a total of 6,317 Nigerians that have returned back home in this era of COVID-19. The breakdown is here, I'll give you, but under this administration, 501 Nigerians returned from South Africa, and the Diaspora Commission was on ground to receive them warmly with starter packs, some transport money, and then we also have programs for them with SMED and NDE, which we are still monitoring. There has been some break in transmission because of COVID-19, but we're in touch with quite a lot of them who wants to remain in touch with us. UAE Dubai has had the largest number of batches with 1,405 back home. From Turkey, we've had 2 batches, 324. From Sudan, 3 batches, 365. And most from Sudan were mainly students. And when they see that you're standing up for your citizens, nobody will take you for granted. However, as the president always says, let us also behave ourselves wherever we find ourselves. Let's be good ambassadors of our country. But where a Nigerian is being wrongly treated, NITCOM will be there.
In the meantime, the Minister of Aviation has clarified the resumption dates for international flights, contrary to reports that it would resume in October. In a tweet, Mr. Hadi Sirika says no date has been fixed for the resumption of international flights, and in conjunction with the Health and Foreign Affairs and also the Presidential Task Force on COVID-19, an agreed date will be announced maybe earlier than October. He said that the National Airspace Management Agency only issued a routine 90-day notice for airmen. The federal government had placed a ban on international flights following the outbreak of COVID-19. Now, it was excitement as domestic flight operations resumed at the Kaduna International Airport today amid strict safety protocols and also an impressive turnout of passengers. However, as the aircraft returned to the skies, most airlines and airport management continue to ask passengers to comply with the federal government's guidelines on keeping safe this period.
Local flight activities kick off at the Kaduna International Airport more than 3 months after the nation's airspace was shut owing to the outbreak of COVID-19. The first flight from Lagos to Kaduna touched down at about 7:30 a.m. The airplane is welcomed by the traditional water cannon amidst excitement from passengers. At the airport's departure hall, passengers are required to wear face masks, observe social distance, and use hand sanitizers. Thermometers are also in use to check body temperature. Following the approval for resumption of flight operations, the Federal Airport Authority of Nigeria released new guidelines for air travelers and other airport users. The new standard operating procedure, according to the manager of the Kaduna Airport and the director of Aviation Security Services of FAN, is aimed at protecting all passengers, staff, and curb the spread of COVID-19.
COVID-19 is not from the aviation sector. The airliners have taken the procedures as prescribed again by the Presidential Task Force, and we have done everything possible within or humanly possible to ensure that passengers don't contact COVID-19 from the airports.
This thing is not about Federal Airport Authority or NCAA or any of the aviation agencies' responsibility alone. It is something that has to do with human life, and we are all involved. As such, let people take it as a challenge that they should assist in checkmating each other.
The new standard operating procedure at the airports requires that air passengers and airport staff must follow all safety protocol, while every luggage must be disinfected before entry into the departure halls.
Now, following the rise of coronavirus cases in Kwara State, the government has announced that residents must now wear the face mask, observe physical distancing to avoid being arrested. Briefing journalists, the spokesperson of the COVID-19 committee in the state, Mr. Rafiu Ajakaye, says it is now compulsory to abide with the rules and adhere to these safety protocols. According to him, raids on nightclubs and viewing centres will continue and violators will face sanctions from the 31st of this month. Well, Dr. Belinda Uba is a public health epidemiologist, field epidemiologist, African Field Epidemiology Network, and she joins us on the program from Abuja. Thank you for joining us. Tell us, we're seeing some states in Nigeria, just like several countries, adopting stricter non-pharmaceutical interventions like fines for not wearing the mask or even arrests, and then in some places compulsory wearing of the masks indoors to keep the virus at bay. What do you make of these measures?
Thank you for having me. I think the measures are quite right. They are measures in the right direction. We know that COVID-19 is a new disease. We are all learning from it. And we know that part of it is making sure that we put in all the necessary preventive measures. The wearing of face masks, the physical and social distancing, the hand washing. I think those are very right measures that the government is putting in place. And we really want to advocate to our people out there to actually make sure that they are adhering to this. A lot is happening out there. A lot of people are still not putting on their face masks, and we begin to wonder. We don't have any vaccine yet, so the only way we can prevent ourselves from COVID is really making sure that we put in all the non-pharmaceutical preventive measures. And part of it is using our face masks, whether indoors, in populated areas, and when we are outside there. So I think there are measures in the right direction, and we really will want to encourage everyone to really adhere strictly to these measures, make sure that in public places people are observing all the necessary physical distancing, there's hand washing equipments, People are putting on their face masks at any point in time just to make sure that we do not really have to come into contact with this COVID and either contract it or take it to our families as the case may be. So I want to say that these are measures that are in the right direction, and I think the government is doing a lot to ensure that people are really adhering to these measures.
So would you say that there is enough information and enlightenment, ongoing to make sure that people actually know what kind of virus that they're up against, and which would, of course, influence their behavior towards protecting themselves and their loved ones?
Yeah, I will say the government has really done a lot in terms of trying to educate the people. Right from when we had the very first case of COVID-19 in Lagos, we've been having a lot of jingles. I mean, anywhere you go out there, the radios, the TV stations, we have jingles running on a daily basis. Before every program, there are jingles on the preventive measures, use of face masks, hand washing, social and physical distancing. Government is really doing a lot in this regard. I think we really have to take it upon ourselves as individuals to make sure that we adhere to these measures. Part of it is for people to really know the risk involved, because a lot of people out there still think that COVID does not exist. I've come across so many people who will still say, oh, there's no COVID, this is just a propaganda by government. They want to see people die near them before they can really believe that COVID is out there. But we get all these jingles running in the TV stations, educating the people about COVID, educating them about the risk involved, educating them about how we can actually prevent ourselves from coming down with COVID. So I think a lot is out there. A lot of messages have gone out there. It is now left for people to actually accept these messages, have some trust in government, believe in what the government is telling them, and adhere to these measures. I'm sure if these are put in place, we'll be able to curb and interrupt the spread that is really going around across the different states in the country. We are seeing a rise in some states, even though we could be seeing a decline in some, but in most states, we are actually seeing a rise in the number of cases, looking at the fact that the government is right now opening up the economy, so there's more interactions, there's no restriction. So adhering to these measures is really something that people have to take it upon themselves to change their behavior and to be able to adhere to these measures and prevent the spread of COVID-19 in the country.
Dr. Ba, when you look at the measures that have been adopted, and this is looking at Africa and flattening the curve on the continent, would you say that perhaps our lack of testing is undermining the successes on the continent?
So looking at the country and in the continent as a whole, I would want to say that as a country, we've really done a lot. Like I said earlier, it's a new disease we are learning, and we are actually learning from the mistakes of other countries. You know, Nigeria is one country that is quite diverse cultures, that you really can't just pick up Nigeria and start comparing with other countries in the continent. I mean, when we started having the first case of COVID, you know, I could remember we had just one lab that was testing, and we can see that over time we now have so many labs. We have over 46 testing sites for COVID-19. NCDC then, a lot of Nigerians didn't know about NCDC. Now everywhere, everybody is singing about NCDC. If you wake people from their sleep, they will tell you about NCDC. That shows that the government is really doing a lot. One good thing about the country is that even our political leadership has accepted that there is COVID actually, and they talk about it every day. We see it on the PTF. And we've seen this in other countries where the leadership is not even accepting that there is COVID, and we can see what has happened. So really, as a country, I want to say the country has really done a lot from the advice we get from NCDC, from the PTF, and then what is going on across various states. Yes, we might not have been testing enough at the onset, but right now I think we have really improved in the testing capacity with the many labs we have across the various states. A lot of testing sites are being put up in place, and even the numbers being tested are increasing day by day, including the turnaround time for the results. So prior to now, you could have a situation where results take quite a while before they are released. Now we have situations where tests are conducted, and within 24 to 48 hours, the results are out there. So we are really improving, and I would say the government is really doing a lot. NCDC is doing a lot to really ensure that the testing is being done, the test kits are available across the state. We've not had situations where states are complaining that they don't have test kits. So I think testing is really being improved over time, and government is really doing a lot in that regard.
All right, we appreciate your time. Thank you so much for joining us on the program. Dr. Belinda Oba, a public health epidemiologist. Thank you.
Thank you for having me.
We have more on the global response to the coronavirus pandemic when we return. Over in Bauchi State, the government says it has run out of reagents for COVID-19 testing, and this is causing bottlenecks in its capacity to carry out more testing. In an interview with our correspondent, the Commissioner of Health revealed that the state's financial resources is overstretched as a result of huge sums spent to purchase reagents.
Just 2 to 3 days ago, our second laboratory in the state at Abubakar Tafawa Balewa University Teaching Hospital has come on board. So now we have 2 testing laboratories in the state, in addition to the one that was previously launched. So we have a capacity to test up to 500 to 600 samples in a day. But you know, most of this sampling, as we realized recently, there are some challenges. And the challenges of the testing is basically of the reagents. In Bauchi, all the 2 laboratories, they are using real-time PCR machine. So this real-time is very sensitive to some certain reagent, like the live river. But the dungeon is very difficult. It's not that the laboratory scientists cannot do the dungeon, but it's giving them very, result that you need to be retesting over and over again. So we need support from the NCDC in this regard, which we are communicating. So if we can have enough reagent of the live river, which is very expensive, we can be able to scale up most of this testing in the state.
Let's focus on ways we can improve Nigeria's testing capacity. And Mr. Solomon Cholom, molecular virologist and medical laboratory scientist, is with us again. He joins us via Skype from Jos. Welcome to the program.
Thank you so much. How's Lagos today?
All right. With the rise in cases all over the country and some locations reporting high numbers than others, is there a place for the use of antibody-based test kits?
Definitely there is. For now, the approach has been molecular-based testing, and that testing platform is only looking out for the genes, as it were, of the virus. So, but as we wake up to this present reality, wherein we have disparity in terms of the prevalence of this virus across the country, there are some countries that states that are posting very low numbers. Some are posting very high. So we need to confirm as to the possibility of previous exposure of certain locations to the virus. For example, with the antibody-based testing, we would be able to check, the immunoglobulin M, which is the IgM, the immunoglobulin G, which is the IgG. The immunoglobulin M is the first to be produced upon, an infection, and it recedes, after a while. While the immunoglobulin G, is produced much later and stays for a much longer time. So in a situation where we discover people having the immunoglobulin G, we would be able to, give a picture as to the possibility of previous exposure in those places. And of course, if we have, more sensitive techniques that would be able to do quantification, that is a titration of these antibodies, we would be able to find whether they have developed to levels that would confer immunity. And that is, perhaps, the clue into the much talked about herd immunity we have been talked about, where a large chunk of an infected population develops immunity to confer protection against the virus, so much so that the people would live normal lives in the presence of the pandemic. So by so doing,
Finally, Mr. Chalam, I just wanted to quickly ask you, and this is, how we go about this. If you're saying that this method can indeed help us increase the testing capacity, remember the Federal Ministry of Health, of course, said that there were some antibody-based test kits that didn't meet validation, and we know that there's been approval for the RNA Swift. So where do you see us going next?
Yeah, so the fact that a batch of antibody-based test kits, failed validation does not mean that we can still go back to, work on those kits to raise their sensitivity and specificity levels, including other characteristics. It is just, more of cutting out our job to still go back and do more so that we can come up with viable test kits. The fact is that antibody-based test kits still have a large place in this, response that we are all putting up, because without it, we will be lagging behind in terms of knowing fully well the status of locations and the possibility of gradual build-up of herd immunity, across the country.
All right. We'd like to thank you, Mr. Solomon Cholom, molecular virologist, medical laboratory scientist. Thank you for joining us on the program. Now, due to the coronavirus pandemic, the Nobel Prize banquet has been cancelled for the first time in more than 60 years. The prize winners for 2020 will be announced, but the event, usually held on the 10th of December, will not be going ahead. Instead, the Nobel Foundation said awards and ceremonies will be held in new forms. Now, the event was last cancelled in 1956 in protest at the Soviet Union's invasion of Hungary and during both world wars. Here's more on the global update.
The U.S. continues to see rising cases across many states. On Monday, the state of California recorded a daily rise of more than 11,800 new infections, making it the highest daily number the state has seen so far. And if California was its own country, it would now rank 5th in the world after the US, Brazil, India, and Russia. President Donald Trump, who previously refused to wear a mask, has tweeted a picture of himself wearing one with a text saying many people believe it is a patriotic duty to wear a mask if they can't socially distance. Indian researchers are reported as partnering with those at Oxford University on the vaccine reported on Monday to begin local trials soon after a license has been obtained. Oxford University said the vaccine appeared safe and triggers an immune response, though it is still at development stage and will go through further rounds of testing. Meanwhile, China says a phase 2 trial of a COVID-19 vaccine candidate conducted in the country has found that the vaccine is safe and induces an immune response. The results provide data from a wider group of participants than the phase 1 trial, which was published in May. Phase 2 trial adds further evidence on safety and immunogenicity in a large population than the phase 1 trial. In another development, aviation authorities say passengers who book flights to the country must prove they have recently tested negative for COVID-19 beforehand.
With other protocols, wear your face mask on your face, definitely not your chin, as it has no value under your chin. You can take a closer look at more information on the pandemic. Our website, channelstv.com. It has the latest updates. All you need to do is log on, www.channelstv.com. You can find the latest. We have the COVID-19 vaccine studies. There is an offer, a hope, as WHO is warning Africa on acceleration. There are several other stories also that you can take a closer look at. That's the program this evening. Thank you for watching. I'm Millicent Nwonka. Stay safe.